like my vagina is gonna fall out. This is a normal conversation, I'm not even kidding, that I've had with my coworkers at the lunch table. My name's Dr. Nicole. I am a physical therapist and a mama of 2 myself, and I quite often have conversations about what my vagina feels like and what my friends' vaginas feel like and what my clients' vaginas feel like. So after having a baby, sometimes we notice that it feels like our vaginas are kind of like bulging. It might feel like a rubbing, so you're walking or you're a runner, you're just doing a lot of walking with your job, and it feels like your vagina is literally like rubbing between your legs. Sometimes people say it feels a heaviness, a falling out sensation, painful, sometimes not painful, but all these are probably a sign that you might have some prolapse. And the great news is, I'm just gonna get this out there, your vagina is probably not actually gonna fall out. So that is really good news. What happens is our pelvic floor is made up of lots of muscles. I think there's actually 11 different muscles, and they act like a hammock and they hold everything up into our bodies. And after we are pregnant or we've done some kind of activity like a lot of heavy lifting, maybe with our job, maybe the way we work out, or we're just straining a lot because we're constipated a lot, lots of different reasons why this can happen. But basically that pelvic floor hammock just like gives way. It's like when someone way too big or multiple people sits in our hammock that we hang out in the trees, and pretty soon that hammock is like touching the ground and might even rip. When that happens, that is no good and it no longer can hold everything up, and this is exactly what happens with our pelvic floor muscles. So there's 4 different kinds of prolapse that someone could experience, and it has to do with what organ starts to protrude through our pelvic floor. If you have an enterocele, it means your small intestine is bulging out. If you have a rectocele, it means your rectum is bulging out. Cystocele is your bladder coming down through your pelvic floor muscles. And then if you have a uterine prolapse, that is when actually your uterus starts to protrude down through your pelvic floor muscles. There's different levels of this. It can be graded on how far. First of all, let's get this clear. Your vagina is not the part you can see. So some people call that your vagina. That's not. That's actually your vulva. So when I'm talking about your vagina, we're talking about the opening and internal part of your lady parts. So what happens is those organs protrude different amounts down through the vaginal canal. Sometimes they do actually come out and you can see them outside of your vulva when you bear down with something like a cough or like, that is when those organs protrude down through your pelvic floor muscles. And you have a few different options. So depending on how much this bothers you or how severe it is, because actually a lot of people have prolapse and are like, I didn't know that. Maybe an OBGYN will tell them this, or maybe they'll be talking to friends and like, oh yeah, I guess that does happen to me, but it doesn't bother them at all. And if it doesn't bother you at all, it's probably okay. But if it does bother you, you have a few options. The most conservative way that people deal with prolapse, and usually the first thing you want to try, is pelvic floor physical therapy. That's me. So pelvic floor physical therapy is basically where you learn how to strengthen, get your pelvic floor muscles coordinated. You're going to avoid different activities that strain or increase your abdominal pressure and cause that prolapse to get worse. So you're going to avoid things like that. And you're going to do more activities that are going to protect and get your pelvic floor nice and strong. It's not crazy complicated. It's just basically bringing it to the front of your mind and learning how to manage abdominal pressure. So that's the first step usually. If that isn't enough to correct your prolapse, they have different types of pessaries. This is one type. This is by Urista, and this is something that basically is just inserted. It this is weird, but it kind of looks like a pacifier or like a ring pop. But basically you insert that into your vagina, it stays in there, and it just holds everything into place. Sometimes different types of pessaries. You can even have sex with them in. You can leave them in. You just take them out to clean them every once in a while. That's a whole nother video about how to care for a pessary. But what I want you to know is that you can use things like this pessary to hold your organs in place. I've also heard of women that just use a pessary when they run because they really love running and that's the only time their prolapse bothers them. They want to get to the CrossFit gym, put in their pessary. When they're done, they take it out, and the rest of the time they can manage their prolapse. You think of a pessary kind of like a sports bra. It's something you're using to, hopefully it's a short term. I do know some people use them long term. It really depends on your situation, but most people use them short term to be able to do the things that they want to do while they work to strengthen their pelvic floor muscles, or while they're waiting to have the third option, which is a surgery. I don't know a lot of details about the surgeries that can be done for prolapse because that is where a urogynecologist comes in. I think OBGYNs can do them as well, but urogynecologists are really like the specialists in this type of a thing. And they are basically going to sew tissue back together and make sure that ligaments are holding all your organs in place where they need to be and prevent them from being able to come down and bulge through your pelvic floor muscles anymore. So those are your 3 different options. If you are interested in learning about working with a pelvic floor physical therapist like myself, I would be honored. You can go ahead and click the link below and we can have a phone conversation about if you are a good fit for either my personalized programs where I have you fill out an intake form and then I send you a program that'll work for you, or sometimes it's better to work one-on-one. We have video calls and we work together for whatever the amount of time is we think you would need, and I can walk you through the rehab process of correcting your prolapse and getting rid of those nasty symptoms that bother us a lot sometimes. So bottom line, if you are noticing dragging, bulging, falling out sensations, these are not normal just because you had a kid. They are probably because of prolapse and dysfunction in your pelvic floor, and pelvic floor physical therapists can help you work through that correction process. So please don't hesitate to click that link below and check out the services I can offer you. But at the very least, if you could give this a thumbs up, if this video was helpful to you today, I would greatly, greatly appreciate it. It helps me know what kind of videos you guys like so I can make more of them. Thanks for tuning in today, and I will see you when I post my video next week.